Welcome back and thank you for staying with us on The Conversation. Now, public health emergency has been declared by the Africa CDC due to the rapid spread of Mpox across the continent. The Democratic Republic of Congo is among the hardest hit, with a significant number of cases and deaths reported. Now, as the situation continues to unfold, health officials are working to contain the outbreak and address the unique challenges it poses. With concerns around vaccine availability and healthcare resources, there is a need for urgent action. Now, joining me to discuss or enlighten us more on this is Professor Oyewale Tomori. He's a virologist. Hello, Prof. Good evening. Thank you so much for joining me at this time.
Thank you. It's a pleasure being with you.
All right. Can you briefly enlighten us on what Mpox is, its key characteristics, symptoms, and also transmission methods?
Well, it's a disease much like the old smallpox. We don't know too much about it, but it's been eradicated since 1980. But this is a disease which supposedly originated from animals. And after the world had eradicated smallpox, monkeypox, which have been existing, the pox virus is found in virtually all different kinds of animals. But each animal has a group of pox viruses. So after we eradicated the smallpox, which is the human pox, we then go to the situation where now the other pox viruses are now showing up. Usually, this disease starts with, and then rash is one of the most common. And you have rash in the different parts of the face, on the arm, on the leg. It varies from each the kind of rash that you get. And don't be confused with other rashes. Then laboratory then is needed to confirm that Mpox. It used to be called monkeypox before. Now it's called Mpox virus.
Okay. Now, but what factors in Africa are contributing to the rapid spread of Mpox and causing heightened concern, especially among health officials?
Well, I think you remember between 2022 up to about 2023, there was a rapid spread of the virus all over the world, which started from Europe and then went to different parts of the countries of the world. The world then, WHO declared it what we call a public health event of international concern. But then that stopped. And then it wasn't as if Africa was free. We've always been having monkeypox since 1970. But of course, the world didn't take note about that. We too did not take note of our own problem. So, but when it came in 2022 and spread all over the world, then it became a global thing. Now, when they stopped, the world stopped about it. But then the situation continued in Africa. Now we are seeing a great upsurge in DR Congo, which is now spreading to other countries, neighboring countries, Burundi, Rwanda, Kenya, Uganda, and even South Africa. So this is why the whole world is getting quite worried now. In the last year, for example, the number of cases more than doubled. And is now spreading, young people are getting it. But I think what's most significant about it is the fact that there is a sexual transmission. This was not reported before, the type 1. So there are two types. There's what we call the clade 1, which is found in Central Africa, and that is in West Africa. The clade 1 is more severe because it's the most severe infection with death, higher level of death than what you find with the clade in our region here.
Okay, Professor, but what unique challenges does it pose, especially in terms of diagnosing and also tracking, especially in resource-limited settings like Africa?
I think in Africa, we always have a problem. The countries that have been having Ebola for the last 50 years, Lassa fever, last 100 years, we're talking of poor surveillance. The crux of the matter is the earlier detect infection, better for everybody, because you can then see the case, do a contract testing, isolate them, so I don't spread it to other people. But when you have your surveillance is very poor, then people will get it before they report it. It has spread to so many people. And that's what is happening to us in Africa. Our surveillance has never been up to par. Laboratory diagnosis has, remember I mentioned that it's a kind of rash, and there are different things that can cause rash. So you need a lab to confirm that this rash is caused by, monkeypox. So our laboratory system has gone haywire. The surveillance is not functioning. We have abandoned all that one, and that's where we are. And to think that Africa that spent so much money during the COVID set up laboratories, the question you'll be asking yourself, what happened to all those laboratories? These are questions that we need to be asking ourselves.
You did say, still talking about, resource limited settings, you did say that in Africa we always have a problem, especially when it comes to, resources and diagnosis and also testing. But when it comes to the response to the outbreak in Africa, are there implications of declaring the Mpox a public health emergency, for African countries, especially poor ones like Congo, who actually have limited healthcare resources?
Good. I was quite happy when the Africa Center for Disease Control declared it an emergency, emergency. I think we are showing the fact that we are taking care of our own problems. Ordinarily, we are waiting for WHO Geneva to declare it for us. It's like I have an emergency and I'm waiting for an outsider to declare that I have an emergency in my house. So I'm really quite glad. But having done that, that's the first step. The next thing is, what do you do after you declare it? What do you do with your resources? Put your money where your mouth is. And that's what Africa has not done. And I hate hearing this thing about poor resource country. Africa is poor. We are not poor. We are misusing our money. The funds we waste, 1/10 of that will solve the problem we're talking about. I mean, go around to African countries, DR Congo itself, and all those kind of places. How much of money we waste? If we spend our money right, we won't be begging anybody to come and take care of ourselves. When we are having the children, having all the population, we don't beg donors to come and have the baby for us. Now we're having the babies, we are begging them to take care of them for us. We should be ashamed of ourselves. And that's the situation, that's the message we need to get out to our leaders.
You said put your money where your mouth is, and you did say that Africa is not poor. But looking at the significance of this declaration, how do you think it will impact travel and trade in these affected regions?
It's probably not going to make too much of a difference. Because first of all, our borders, who controls our borders? I mean, people are moving from across Rwanda, Uganda, and everything. So all you thought, maybe occasional stop by this thing. I don't think it makes that much of a difference for us, as far as I'm concerned. Sorry, the light just went out in the hotel where I am. Can you hear me?
Yeah, I can hear you. Please go ahead.
Yeah, so I mean, these are the kind of challenges we're talking about. You are talking in a first-class hotel in Africa, and the light goes out. Yeah, these are the issues, and you're talking about we're poor. We're not poor. We're misusing our money, and that's where we're getting to where we are. And you remember Nigeria has been putting a lot of money into electricity, 16 billion or whatever. Is that what result we're getting for it? And you talk about poverty. What?
Hello, Professor. Can you hear me?
Yeah, I can hear you very well. Only I'm in darkness.
Okay. All right. Fantastic. Because we lost you for a bit there. All right. So now let's talk about community engagement. Now, what do you think is the role of community engagement and awareness in controlling its spread?
I'm glad you asked that question.
Welcome back.
The issue with us is that the reason is the fact that the whole control of disease is actually with the community. Most of these cases start in the rural villages, in the rural areas. And because they don't report to those who will act, it takes like another 4 or 5 10 years to spread. If you empower your community to identify and report and give them the resources to do that, then, of course, the case that is seen now, within a few days, you can actually isolate it, and then it doesn't spread. So we need to spend a lot of efforts on our community, get them involved, get them participate in all these activities. Not sit down in Abuja and say you're controlling disease in my mother's village, when you don't even know the road to get there. So we need to get to those people, let them be part of the efforts to show that, as soon as it occurs, we report it, and action is taken. Each has its own capacity. Let's use that, maximize the capacity we have at a different level to ensure that we all work together. That's what I think this declaration should be doing. Get those African leaders to end up, put the money where it is and not squander our money and put it in foreign banks who then take the interest and give it to you as loan and charge you for that. I think we behave like we don't have sense in many of African countries.
All right, talking about having sense, we're hoping that lessons have actually been learned from COVID-19 pandemic. But, let's talk about the healthcare workers. We know how much the COVID-19, affected them back then. How do you think that healthcare workers can or should be protected and also supported in responding to the outbreak?
First of all, knowledge is important. I'm glad you mentioned COVID-19 and you assume that we learned lessons. The lessons we learned, we have forgotten. That's why the epidemics are spreading. Nigeria had cholera, we had diphtheria, even though we just 500 million to control COVID. We build 100 and something laboratories. Where are they today? These are issues that we need to learn lessons, or even we forget lessons as quickly as possible. Now, what do? We need to educate our workers. These are the symptoms. When you see one, take the proper precautions. Infection, prevention, and control. Those are the kind of things you need to let your workers know. And when they learn that, a case comes in, you're on the alert, and you don't go rushing in. You handle this case with the proper. Provide them with those basic essentials, like gloves and things, the coat they wear. Make sure that all these people have it. And once they know that and they know what they're dealing with, they know how quickly to isolate and this or that nature. That's the first thing to protect. Ideally, if you have the vaccine, then you should give them. They should be the first line of defense. But you're not going to admit the vaccines are not happening in the world. This is all over the place. And they are cost cracking. But before we get the vaccines, there are certain things you and never can do. Ensure that we don't spread the disease.
Definitely.
So that we have the capacity for. But we're waiting for vaccines. They never come for the next 20 years. It comes anyway. We don't have the money to buy it because our leaders have spent their money to enrich themselves.
Still on that line of thought, Professor. So you talked about, we're waiting and all that. What are the consequences of not adequately addressing the Mpox outbreak, in Africa? Not doing it ourselves and waiting for the WHO or international partners to come and help?
Well, the consequences are clear. That's what we're seeing now. It was something that the world had declared monkeypox out of order. The rather is spreading back, is now resurging with very virulently and violently in Africa. That's the consequence of not dealing with the disease. As I mentioned, that any disease you neglect anywhere will spread everywhere. It was DR Congo, now we're talking of Burundi, we're talking of Rwanda, we're talking of Kenya, we're talking of Uganda, we're talking of South Africa. It's spread all over Africa. We have our own here. Part of the reason why we're not talking about monkeypox in Nigeria is not because it's not happening, but because, again, our surveillance health is failing. All the years I keep referring, the money we spent on COVID, building 100 or so labs, where are the labs today? Are they functioning? Before COVID finished, 60% of them were not functioning. These are the issues that we need to be addressing.
Okay. All right. Well, thank you so much, Doctor. But before we let you go, in just 1 minute, can we have your final thoughts, especially on how Africa CDC should coordinate with international partners to respond to the outbreak?
First and foremost, our government, our leaders should support the African CDC for what we are doing. The declaration is the first step. Putting your money and committing yourself to the declaration is the next step, and that's in the hand of our leaders. Identify we have a problem, and then put money into to solve the problem. And I said we have enough resources to do that if we will not squander our money.
Okay. Well, thank you so much, Professor Oyewale Tomori, a virologist. We appreciate you for taking time out of your busy schedule to speak to us on the conversation this evening.
Thank you very much.